are joined today by Maureen May, president of PA-SNAP, the Pennsylvania Association of Staff Nurses and Allied Professionals. As of last week, 2 unions within the Temple University health system were planning a strike. Why was that?
There are many reasons why we were planning for a strike. And the number one reason is for patient safety, patient advocacy, and how we get there is through making sure that we have language in a contract that protects the patients and serves the employees in their work.
What is the status of that strike currently?
So as of yesterday morning at 8:30 a.m., we had a 24-hour long marathon of bargaining. We did come to a tentative agreement. We have not ratified or voted on that contract yet.
How common is violence in a medical facility?
It is very common and very underreported. And we do surveys, and there's plenty of surveys and data out there as to the amount of violence that happens, but it doesn't capture what actually happens on a day-to-day basis. And we did a survey at Temple University Hospital of the professionals, technicals, and nurses to capture some of that. And 2/3 of our members, and we have 2,600 members at that particular local, have 2/3 have said in a survey that they have personally have experienced workplace violence.
What are some examples of situations that these medical staff members may find themselves in that are violent?
There are many, and whether it is being grabbed, punched, spit on, hit, there's threatened verbally that they're going to wait for us outside and get us, whether it's family members or the patients. Just recently at Temple, a patient threw a piece of furniture through the window. We also had where we believe there was an active shooter in the emergency room. And another one that we emphasized was the assault to an emergency room nurse, where she was actually assaulted physically and sexually.
What are some security measures that healthcare facilities currently have in place?
So I can't speak to all facilities, but every facility should have some level of detecting weapons walking in the door. And that's what we worked towards last contract, and we were able to get weapons detector as you come through the door. Also, it's not even just the prevention, it's once the prevention happens, what's the response? Because we understand that workplace violence will happen. We need to be ready to respond. And so for a caregiver, when it's a patient or a family member, that has to be responded to by not just the direct care person in the room, but by a team that can assist in de-escalation, because our activities with care continue. However, we need the supports, and the prevention begins from you walking in the door, whether it's a visitor or family member or the patient, having somebody be wanded, when they come in the door. And even just in the systems, if a patient or a family member of said patient has a history of violence, flag it in the chart so we know what, to anticipate and put measures in place to correct that.
Did something specifically happen to cause the unions to want to add this to their contract? Was there a specific incident to trigger this?
There isn't a specific incident. We as unions know that workplace violence is a priority legislatively. We have a voice, though, to actually speak to the incidences, the particular issues. And what we want to do is make sure that everybody across the state has some level of prevention protection. And there was contract language, and we call it health and safety language in our contract. We already had language, but the language we had and the processes in place obviously did not, it did not meet the level where we did a survey after having a contract ratification and settled 3 years ago. We redid a survey, and we had 2/3 of our members saying that they have been assaulted or experienced on some level of workplace violence in the facility.
Can you talk a little bit about PASSNAP and the work that you do?
For me, personally, I'm a registered nurse, and I work at Temple University Hospital. I've been a nurse for over 42 years, and I still work in direct care. I work in maternal health in the NICU, and I am also the state president of PASSNAP. And my work obviously starts every day with making sure that we have legislation and bills and contracts that help the nurses and the healthcare providers be best take care of their patients. And that's one of our priorities at PASNAP, or several of our priorities are certainly around patient protections, whether it's a private equity bill, whether it's a workplace violence bill or a staffing bill. Those are the three bills that we have seen go through the House and on a bipartisan level. And it is a bipartisan matter. It's not about us as a union wanting something. It's about the union wanting the greater good for any healthcare worker, to make sure that they have process and opportunities in place. The other things is basically having basic assessments. Bring the direct caregiver into the table. Have to bring them in and have them sit at the table and discuss areas and share the ideas of where they believe there could be a better workplace, and preventing certain areas, an unlocked door, whatever that looks like. Bringing in an outside group to take a look and consult with as to what that risk assessment is and areas of vulnerability.
What benefit is there to having a union for nurses?
Oh, it's a voice. It's a protected voice. It's the opportunity to stand up for any issue that you need to stand up for, especially when it comes to patient care. You have that opportunity. You have the opportunity to report. You have the opportunity to follow through. And that is really probably the most important piece of having a union, is a protected voice in order to advocate for your patients.
Are nurses trained to handle these potential violent situations?
Nurses are trained in de-escalation techniques, and nurses de-escalate naturally. It's part of what they need to do when a patient is in pain or angry, or they're coming out of anesthesia. We know how to do that. The de-escalation techniques, and they have this program where you can handle, it's called Handle with Care at our facility. It gives you an opportunity to understand how to protect yourself, but it isn't the bigger picture. But again, all healthcare workers should be provided with this. And not only that, they should be provided with the backup support. We need the backup support, no matter how many times I go to look at an health stream module, which is something that we look at when we're being taught how to do our job. Looking at something online and actually physically doing it, yes, that's important, but we also have to tend to the patient, so we need that backup support. We are trained registered nurses, healthcare providers, respiratory therapists, social workers, whoever you are. We are trained in our expertise of what we need to do to care for the patients. What we need is backup that are trained and there to protect us and assist in de-escalation.
And what would that backup look like? More staff members or security?
Yes, it would mean more security, quicker response to incidences. That all is part of what we were trying to put forward, to have higher levels of security, more security, any security. So the security is really needed to help de-escalate, because our care continues with other patients while we're in the actual event of workplace violence. We were really looking for additional security measures, but also security people. And that's really where we are. We want to have the best team available. There's a team of folks available, but there's not enough of them. And they've reduced the number of them over the past couple of years. And for the healthcare worker, knowing that you don't have to worry about getting hit or threatened, we're not saying that all workplace violence can be prevented, but plenty of it could be, or easier mitigated by having that backup team or having properly trained folks to do the work that we need. That security is everything for us.
Now, how do you determine if a situation is about to become a threat or violent?
You can determine it through your own assessment, or you can start to, as a nurse, you obviously do assessments and you can see if a family member or patient is beginning to escalate. We do work on de escalation. And, sometimes it just doesn't work, especially if you're having someone who is, in a mentally bad state. And a lot of people are in their most vulnerable state, and their families are most vigilant when they're with their loved one and they're taking care of them.
Why do nurses have such a high risk of experiencing violence in their workplace?
I partially believe, or really believe, that a lot of it is related to proper staffing. If you're not getting your pain medicine, or your family member's not getting your pain medicine, or even being taken to the bathroom, their anger is easy. Anger is easy. And that's, how folks deal with their frustration of their family member or themselves in a very vulnerable position. And that's really, we're all going to be in a vulnerable position if we're in the hospital. And if you do not have the proper staff to take care of the needs, and if your needs aren't being met, and they're basic needs, there will be an opportunity for anybody, whether it's you, me, or a patient. We'll all be there one day. There's only so much that that's in that vulnerable position can handle, and there's an expectation of care.
Are there any legal statuses or processes that hospitals must follow to report violence?
No, there is not. And so this is the other piece I think the legislation speaks to, which is House Bill 926 that went through the House. I guess it was in May. Oh, Nurses Day. How can I forget that? The bill went through on Nurses Day, and it was such a bipartisan vote. It was 124 to 79. And for us, that was such a victory. So is the process there? No. It not to the state, and not for any of measures with the state where it's reported. We can report in our own systems, our incident reporting systems, but I'm going to tell you, nurses don't report. A lot of time, healthcare workers do not report. By example, and I learned of a nurse in the emergency room at Temple who actually got bit, and there was a picture that was sent to me. And so it was a terrible bite. And when I spoke to her, she's a 20-year veteran. And she said, I would have been fine with them pulling my hair and pushing me. She said, but once I got bit, I had to escalate it. So we are programmed to believe that, we have to keep moving and doing our job, and understanding that, this happens in the line of work. But now it's really not a thing that we should never have to accept any workplace violence, but we do. And again, it's underreported. But what the measures again the measure would be to report it. Look at hospitals or healthcare facilities that have an excess number of this, and why we have to figure that piece of it out. But I know that hospitals don't want that reporting mechanism.
Can you talk a little bit more about what the legislature has done to help nurses and other people in medical facilities with violence or any other protections?
Well, it hasn't gone through the Senate yet, and it hasn't been signed by the governor, but putting this out there and working legislatively and making sure that we, advertise and let our community of healthcare workers know that this is a possibility and this can happen. And what it has done is it's put the actual workplace violence issue out there for everybody to see. And when we at Temple, we had put some videos out there and different things that happened. People were shocked. They would call me and they say, "Does this really happen?" And we know it happens. Ask any nurse. ask any nurse that has been engaged in that, trying to de-escalate and then getting hit anyway, or spit or threatened, pinched, whatever it is. Mm-hmm.
According to the Metro Philadelphia newspaper, the unions were also concerned about wages and health benefits. What were they looking for?
They were looking for cost of living, wage increases, across the board. And as far as the healthcare, there was a proposal on the table to increase the costs for that. So they were the basic asks there.
And how has this, need for health benefits and higher wages, how has that impacted the nursing workforce?
Well, it obviously benefits and proper support systems, whether it's your income or it's healthcare. How does it support us? It supports us because it actually retains nurses that have the experience and are qualified to do the work. And especially since really nurses leave the bedside because it's not that we don't have enough nurses licensed in the state of Pennsylvania. We have plenty, but we don't have enough licensed nursing professionals in the state of Pennsylvania that want to actually stay at the bedside. They want to find a different opportunity. And on the back end of it, as a nurse who is assaulted or does have workplace violence injury, that creates a moral dilemma. It's a moral injury, and there can be long-term effects, and that's how you lose good, qualified, trained nurses and healthcare workers, is because if you experience that at the bedside in your workplace, you really don't want to work there. You want to find something different, and that's happening, and it has happened.
We've been speaking with Maureen May, president of PCN, the Pennsylvania Association of Staff Nurses and Allied Professionals. Thank you for your time.
Thank you very much.